Radiation therapy is a total game changer in the fight against cancer, but it's no secret it can come with side effects. Today, we're going to talk about one of the most common ones, radiation proctitis. If this is something you or someone you love is going through, we're here to help you understand it, what it is, why it's happening, and most importantly, what you can do about it. So let's get right into it.
Look, getting through cancer treatment is a massive deal. It's a huge victory. Now it's all about managing what comes next. Think of this explainer as your friendly guide to understanding one of those after effects, so you can feel more in control of your health and know exactly what to ask your doctor.
So first things first, what in the world is radiation proctitis? Well, put simply, it's just inflammation of the rectum caused by radiation therapy. But, and this is a really key point, it's not just one thing. It actually comes in two different types.
The first kind is called acute proctitis. You can think of this as the short-term version. A lot of people get this during or just after their radiation is done. It happens because the radiation affects the fast-growing cells lining the rectum. But here's the good news. This kind usually gets better on its own. The second type, and the one we're really going to focus on, is chronic proctitis. This one can show up much later, and it's caused by a totally different kind of damage, this time to the small blood vessels. And this is the one that almost always needs some treatment to get better. So when does this chronic form usually make an appearance? Well, for most people, symptoms start to pop up somewhere between 8 and 12 months after they finished radiation. It can definitely be diagnosed later than that, but that 8 to 12-month window is kind of the sweet spot to be aware of. By far, the #1 reason people see their doctor for chronic proctitis is rectal bleeding. You might even hear your doctor call it hemorrhagic proctitis. It can be super mild or sometimes a bit more significant. But this bleeding is really the main symptom that all the treatments are designed to fix.
So you might be wondering, why does this bleeding even happen, especially so long after treatment is over? Well, the answer is actually hidden in the tiny little blood vessels inside the rectal wall.
Okay, here's a fancy medical term for you, telangiectasias. Sounds complicated, but the idea is simple. The radiation can damage the original healthy blood vessels. So as your body tries to heal, it grows these new, super delicate vessels. I want you to picture a fragile little spider web. Because they're so flimsy, they can break and bleed really easily, and that's exactly what's causing the bleeding. So if you're having symptoms, how does your doctor figure out if this is really what's going on? The great news is that the process for diagnosing this is usually very straightforward. Let's walk through what you should expect. The diagnosis really comes down to a couple of key things. First, your doctor's going to chat with you about your radiation history and what symptoms you're experiencing now. Then, they'll most likely want to do an endoscopy. That just involves using a thin, flexible tube with a tiny camera, a scope, to get a direct look at the lining of your rectum and see what's happening in there. And what are they looking for with that scope? There are a few classic signs that give it away. The tissue might look a bit pale, and they'll be able to see those fragile, spiderweb-like blood vessels we just talked about. They'll also check for something called easy friability. That's just doctor speak for tissue that's so delicate it might bleed with just a gentle touch from the scope. Seeing these signs is usually all they need to confirm the diagnosis. Okay, so you have a diagnosis. Now for the most important part, right? What can we do about it? Let's dive into the treatment options, which, by the way, are highly effective. This is the million-dollar question for anyone dealing with this. And while the symptoms can be really frustrating, I have some genuinely good news for you. There are excellent ways to manage and stop the bleeding. Now, there are some medications, things like special enemas, that can help soothe the symptoms. But honestly, for a more direct and long-lasting fix, endoscopic procedures, treatments done right through that same scope, are often the most effective way to go. One of the most common and successful procedures uses something called topical formalin. Here's the play-by-play. First, your doctor uses the scope to get a clear view. Then, they apply a tiny bit of this formalin solution right onto those fragile blood vessels. The solution causes a chemical reaction that basically seals those vessels shut, stopping the bleeding right at the source. It's super precise and targeted. So, does it work? Oh yeah, the results are incredibly encouraging. In fact, one of the biggest studies on this treatment reported a success rate of over 90% in either stopping the bleeding completely or significantly reducing it. That's a fantastic result.
This quote from the medical literature really says it all. Basically, it's easy to use, it's available almost everywhere, it works incredibly well, and it has a very low risk of complications. You know, that combination makes it a top choice for doctors trying to manage this.
Now, formalin isn't the only game in town. There's another great treatment called argon beam coagulation, or ABC.
So while formalin is a chemical solution, ABC uses a special gas and a bit of energy to seal the blood vessels. The goal is exactly the same, stop the bleeding. It's just a different way to get there. It's another fantastic tool in the toolbox.
So, which one's better? Well, when researchers compared them directly, head-to-head, they found that both formalin and ABC work almost equally well. And that is great news for you, because it means you have more than one excellent option. You and your doctor can figure out which one is the best fit for your situation.
Okay, let's talk about surgery for a second. It is really important for you to know that surgery is almost always considered a last resort. We only even start thinking about it in very specific, severe situations where the other treatments just haven't worked.
So what are those serious situations? We're talking about things like bleeding that absolutely won't stop with other treatments, or maybe a blockage caused by the rectum narrowing, or some other very rare complications. The point is, surgery is not the starting line for treatment.
And why is everyone so cautious about surgery? It's because radiation actually changes the body's tissues. They can become less flexible and don't heal quite as well. This makes any operation in that area much trickier and carries a higher risk of complications. That's why your doctor will always try every other effective option first.
Phew, we've covered a lot. So let's wrap this up by boiling it all down to the most important things for you to remember as you move forward. Okay, here are your key takeaways. 1. Radiation proctitis is a known, common, and manageable side effect. 2. You are definitely not alone in this. 3. There are really effective, non-invasive treatments that can get the bleeding under control. 4. Surgery is very, very rarely needed. And 5, and this is maybe the most important, talk openly with your doctor. Tell them what's going on.
And that really brings us to our final thought for you. Armed with this information, you can be a true partner in your own healthcare. So the next step is just starting a conversation. Thinking about everything we've talked about today, what feels like the right first question for you to ask your care team? Thanks so much for watching.